What I have here is just a few questions that have come up from students, and I'm hoping we can have a chance just to chat about those.
I appreciate it.
Perhaps we could start with you talking a little bit about the decision to move away from in-person classes, and what factored into that decision.
Well, I think, at the end of the day, the most important thing that we need to be doing and that guides our decision making is the welfare of our students. When we're thinking about the well-being and welfare of our students, it's a balancing out of our responsibilities to them as educators to make sure that they get a high quality education and student experience. And absolutely, they can't do that if they're not feeling safe and if we're not putting their safety, including their health, first. These are sometimes, tough issues to balance. After hearing from student concerns, I spoke to our student leadership earlier in this week, and we've been also in constant communication with the best healthcare experts, not just nationally, but we have the very best people here locally. We decided that out of an abundance of caution that it was time to take our classes online or remotely because we really wanted to make that decision in a way that was orderly rather than having to make a last-minute panicked decision. Excellent,
excellent. So, as you're aware, there was also an online petition calling for the complete closure of the UW. Did that factor into your decision at all?
I always listen to student voices, regardless of what package they come in. And so I was aware of the petition. At the end of the day, it really was the advice that we were getting from our top public health and medical experts that was key in making that decision. But was I listening to students? Absolutely.
So, Anna-Marie, one of the questions that comes up frequently is, after you've made the decision to move to online instruction versus in-person instruction, why not just close the entire campus?
Well, that's a good question. Truth is that we are not just a workplace. We are not just a campus or educational place. We are people's homes. We provide health care to people from all around the state. And so that had to be first and foremost in our mind.
The way in which this was done doesn't abruptly remove services on which they've been relying for a while, so that they can continue to still get instruction, but yet still take advantage of things such as the counseling center and libraries and other resources that the university has to offer. So what should students do if they feel attendance is being penalized or participation? What would your recommendation be?
We are working very hard with our faculty to make sure that, in fact, that students are not being penalized for the decisions that they make. And in fact, by moving all our classes either online or in some cases where they can't be accommodated, deciding to do grading based on what they do now, by doing those things, we aren't creating those unfairnesses. Everyone will have a notation that their grades this quarter were done under special circumstances.
Now, I know you don't have a crystal ball, but what's your sense of what will happen next quarter?
At this point, all our plans are to start on time. We have a 3-week period to both have a better understanding of the situation, to make sure that we're doing thorough cleaning, as we always do, of our campuses, and to be ready. Together with other institutions of higher education across the country, we are also going to use these next few weeks to think about and plan for the possibility that we might start a week late.
And what would your message be to our international student community?
We are very much keeping in mind your unique circumstances as we are making decisions. For example, the decision that in some cases where we may not be able to do things remotely, we're going to credit non-credit instead of incompletes. We are doing both because we do not want to affect your visa status, as well as for our domestic students, their financial aid status. We are consulting with our excellent international student services. We are consulting with our Office of Global Affairs to be very aware of how our decisions affect you. And that is in part why our dorms will be open for our students over spring break.
Recently, there was a preliminary diagnosis of a presumptive confirmed case of coronavirus in an employee at the university who works in an off-campus location. Did you know about that case before making the decision?
Actually, interestingly enough, the answer is no. We made the decision earlier in the day and then consulted with our Board of Deans and Chancellors and key leadership, and we had a meeting set up in the afternoon, and between one and the other is when we found out. And so I do want our community to be aware of the fact that because of the really great diagnostic work that we're doing as part of our healthcare research mission, we will have more information about positive cases here than probably any place in the country. That is actually an advantage because it means that we can take preventive actions in terms of spread and slowdown. But it will mean that people will be seeing more positive cases here than in other areas. We are already living in a period of high anxiety. We don't want to stigmatize anybody because they are experiencing anxiety and even fear. But at the same time, that this is a time to do our best to stay as calm as possible. The acts of kindness that I have seen from student to student have just been amazing. I have had a number of people offering me their Purell because they feel that my being healthy is important because I'm making tough decisions. It has just been remarkable to me. I have seen people stepping up with care and compassion. I am blessed to be working with this community. This is an amazing place.
Thank you so much. I really appreciate your time.
Thank you so much, and you're one of those leaders.
Thank you.
All right. Thank you.